Okay, thank you. Now, I heard some people had a little difficulty hearing, so if we have a volume issue, please let me know. Don't be shy. Okay, so this session is about mind-body medicine, and it's really about how we transform stress into strength. Well, this is one of my other favorite quotes. It comes from the Surgeon General, who said 7 of the leading causes of illness in the United States can be greatly reduced if we modified a few behaviors. And he was really insightful because he said less alcohol, lack of exercise, so we need to move, poor diet, smoking, but then he put this in, unhealthy maladaptive responses to stress and tension. And I thought that is really insightful because everybody else gets the, oh, I need to be active, I need to get rid of my cigarettes, and so on. So we said that Hans Selye defined stress as our perceived ability to cope. And of course, we saw these two darlings who I couldn't resist putting on again. So about 50 plus years ago, a very interesting study was done by a physician named Dr. Holmes and Dr. Ray. And basically what he said was, are there events that occur in our life, what we call life-changing events, that can have some impact on our health? What do you think? So he studied people for 35 plus years, and he looked at life-changing events, and he quantified them. What are the big ones with the highest influence on someone's life? What are those that have an influence, but they're not as important? What do you think the biggest one is? Yeah, death. Death of a spouse. 1967, he ranked that number 1 based on his research, and it qualified for 100 life-changing units. 1994, death of a spouse was still the highest one. But there were others. Divorce, separation from a spouse, and then there were some that you might not think about. Or you might. Retirement, pregnancy, gaining a new family member. All of these things, some of them are perceived as very, very positive, but they're still life-changing events. And then what he found was this. He found that if people experienced somewhere between 150 and 500 life-changing units, there was a 30 to 50% chance they were going to have some illness, physical illness in their life. So these are the people that I started to see in my practice after the economy turned down in 2008. And that's what made me go back and look at that research. I saw people come into my practice with recurrent chest pain, high blood pressure, all sorts of things. And the major life-changing event that they had was they lost a lot of their net worth. Some people lost their homes. Some people lost their jobs. All of these things that Dr. Ray was talking about 50 years ago. So he produced a number of studies that looked at life-changing events, and this was that scale I showed you, 100 to 600, and number of illnesses. And very frequently, we see this kind of graph. We see people that sort of putter along. This is a gentleman, year 2, year 3, year 1. He's just puttering along in his life, and things are going along smoothly, and then he has loss of business, loss of finance, loss of home, sudden death. Has anyone ever seen this or observed this in anyone's life? No? Yeah. And very frequently, we don't sort of pay attention to it. We say, oh, he was under a lot of stress, or she was under a lot of stress. So this concept of life-changing events enhances the sympathetic nervous system, which we talked about. And not only does it have a profound effect on our blood sugar and our blood pressure and developing coronary disease, it also causes, as you'll see in a few minutes, increased risk of infection and cancer, right? Because our body's immune system needs to be able to fight these things. And it's not that stress causes cancer, but it does set up a cascade of hormones that predispose our ability to fight. So in the New England Journal of Medicine in 1996, they published a report. We had a big earthquake in California. And I was very surprised to find out that this is an earthquake-prone area. Well, we had an earthquake in California, and what they noticed on the day of that earthquake, there was a 5-time increase in sudden deaths on the day of that earthquake, right? So this is acute stress causing an increase in sudden death. There was a big study that was done called InterHeart with over 11,000 people in 52 countries, and they found that heart disease was directly related to work stress independent of other factors. And what they found out in people at work is it's not so much having a lot of work to do, but it's not being appreciated, right? It's not getting that pat on the back, you did a great job, right? British Medical Journal, 25% increase in heart attack admissions on the day London lost to London lost to Argentina during the 1988 World Cup. Right? You're laughing. Have you ever watched people while they're watching the Super Bowl game? I mean, I said to my brother, we're not going to bother with the stress test. I'm just going to put a heart monitor on you. Have you watched the Eagles or whatever his teams are while he's screaming and yelling and talking to the TV? Like, it really makes a difference, right? I was watching him the other night. I don't know if you guys watch baseball? There was some call at home plate for the Met game, and he was just talking to the TV. That's wrong, that's wrong. I thought, what's happening to his coronaries? Okay, so, but it's not just physical. This is what we see. We see loss of clarity and concentration, inability to sleep. You feel like you can't get anything done right, and that doesn't feel good. And some people respond to too much on their plate with anger. Right? And I have seen many people come into my practice and they say, I can't remember anything. I woke up the other day and I didn't know where I was. I must have a brain tumor. And we go off and we get the $3,000 MRI, which is, of course, normal. And then you find this individual hasn't slept for days, and they have so much on their plate, they feel like they can't cope. And frequently, people go through a phase where they become hyperactive. You know, you get a lot of things and you say, bring it on, I can take it. And then the next phase is burnout. And then we say, get me out of here. I don't care, whatever it takes. I don't want to do this job. I'm going to quit my job, going to quit my relationship. I just can't do this anymore, right? So there's a whole curve that goes along with this. And our goal is to recognize where we are on that curve. Are we thriving? Are we having fun? Or are we just surviving? How many of us are going through our day just surviving? So lack of mental focus, clarity, inability to sleep, all of these are signs of too much stress. Now, Louis Pasteur, on his deathbed, said this: the microbe is nothing, the soil is everything. He spent his life trying to prove that it was all about microbes. And he realized that we can pump a virus, for example, into this room right now. And would we all get the virus? No. What makes us different? Our resiliency, our soil. How depleted are we? How tired are we? Right? Our immune system. Exactly. The soil is everything. So really what we're doing with eating right, and sleeping right, and changing the way we respond to stress and tension is strengthening our soil. So this research is quite remarkable. There's a woman named, a researcher, Dr. Glaser, and she said, what happens if I take caregivers and I do a little skin biopsy on their arm? Let me monitor a caregiver versus very well-matched controls, same age, same diseases, everything's the same, except they're not a caregiver. Caregivers versus non-caregivers, simple punch biopsy. It took the caregivers 24% longer to heal a small wound. This is the caregivers here in red versus the control here. Just healing a simple wound. So when do we, as a clinician, ask people, talk to the caregivers of our patients, right? What's going on in their life? This is medical students. If they get that same wound during vacation versus during exam week, and it takes them, on average, 3 days longer to heal the same wound when they're under the stress of their examinations. Right? What about giving people the flu vaccine, which we'll start to do very shortly now? People that are 70 years or younger, caregivers, less likely to mount the response to the flu vaccine than well-matched controls. Caregivers over the age of 70 almost don't respond to the vaccine at all. And when they get the flu, what do we as healthcare practitioners say? Oh, must be a different strain, right? Because we never realized they didn't mount the immune response. So the key take-home message here is we have to think about this not only on the physical body from the, oh, gee, I feel my heart beating, my blood pressure's high, my cholesterol's out of control, and I'm diabetic, oh, I can't sleep at night, but also there's some real interference with the immune system and our body's ability to respond appropriately. So I showed you this slide about high cortisol and low DHEA. It's like a seesaw. And all of these things that we frequently associate with aging are associated with stress. So I hit on this in my last talk. And these are the top 10 US addictions: alcohol, smoking, drugs, gambling, overeating, video games, internet, sex, shopping, and work. Those are the top US addictions. And very frequently when I'm talking to a patient, I always want to find out what's driving the train in their life. What's driving them to overeat? What's driving them to overdrink? Because if I just say to someone, oh, you know, stop your alcohol, there's a good chance they're not going to listen, right? So when we start to look at the influence that stress has, this is where it frequently plays out. So we're going to talk today about resiliency, because resilience is our capacity to prepare for, recover from, and adapt in the face of stress, challenge, or adversity. How resilient are we? You know, putting on a conference like this, how resilient were the conference planners? Or were they just completely stressed out and they'll all get sick tomorrow when the conference is over, right? So that's what resiliency is about. And it comes in a lot of flavors. For example, you could be physically resilient. You could be flexible. You can have a lot of endurance. You can be strong. That's what we call physical resiliency. Mental resiliency. You have a good attention span. You can see multiple viewpoints. You have an optimistic world viewpoint. You're flexible in your thinking, right? It's not just all one way. Emotional resiliency. I have positive feelings, ease instead of resistance. My relationships are good. And then spiritual resiliency. So resiliency comes in a lot of flavors. And really, it's about being flexible, not only physically, but mentally and emotionally. So I showed you this slide earlier, and we're going to look at some of these with a little bit of a different lens. You know, I think this, to me, is the most important thing we can do for stress. Not to have 4 identical babies, but to do this. Let's see if we can get that to work.
Daddy's gonna make you laugh now. Ready? Do it again.
One of the first lessons I give to my patients is I want you to go home and watch a funny movie. You heard the old saying, laughter is the best medicine, right? Sometimes it's as simple as saying, I'm going to change what I'm watching on TV. And you know where I really learned this? I had a patient that would come in congestive heart failure, and I'd send him home on all the drugs and do everything right, and he'd bounce back in. Finally, his wife, who dutifully took him to every appointment, said to me, Dr. Guarneri? I said, yes. She said, do you think this has something to do with it? I said, what is it? He watches all these horrible movies, And he's all tense, tense, tense. And that's when I noticed he goes into heart failure. I said, that's it. The wife noticed it. I said, that's it. Let's have him not watch any of those movies anymore. And he putters along, and 1 month later, with no admission, she comes in and goes, we only watch the Disney Channel, she said. That's it, right? So how do we start to bring joy and laughter back into our lives? A lot of us forgot how to laugh, right? And this is where I think doing things like dance classes and Zumba and laugh yoga, which you might think, oh, that sounds stupid. You will laugh, right? How do we get back to that and lighten up a little, literally, in our life? So Adyashanti said this: suffering happens between the ears. Everything else is just a situation. And of course, Mark Twain, I've suffered a great many fortunes, most of which never happened. So we have to put it into perspective. So we're going to go back to our initiating event, our response, our perception, and our physical effect. And Eric Butterworth put it this way: you see things not as they are, but as you are. Your perception is shaped according to your previous experiences, your faith according to where you are in consciousness. More important than changing the things out there is changing the way you see them, right? So going back to this concept of what's the lens through which I see, and how can I change that? And we're going to talk about that in a minute. So see how this makes you feel. Most horror movies have their effect by changing the sound. If you plug your ears, you usually don't get frightened. So how do you see the world? What music is playing in your life? Where are you coming from? And you have a totally different experience. One is chaotic. We see the world through how we feel. How do we feel? So let's look at our emotional landscape. I like to put it in 4 quadrants like this. We always start on the upper, your left. And I want you to think about it this way. If I have high arousal, adrenaline, fighting, getting ready to go after the tiger or run from the tiger, and then this is my relaxing, these are my negative emotions, and these are my positive emotions. I want you to give me a high energy negative emotion. What might you experience during the day that's high energy and negative? Rage. Anxiety. Give me another one. High energy negative emotion. Fear. Hate. Anger. Right? These are our high energy. Because you're going to then think about, where am I living in these quadrants when we finish this? Because we change throughout the day. So give me a low energy negative emotion. Can't hear you. Annoyance. Interesting. Impatience. Resentment. That could be high or low, right? Depending on how you're feeling at the time. Depression, loneliness, isolation. Defeated. Yeah, exactly. Sad. Now give me a positive emotion that's low energy. Calm. Relaxed. Peace. Satisfied. Didn't hear that one. Joy. I almost going to put that up here, but I'm going to put it in either one. Now give me a high energy, positive emotion. Euphoria. Excited. Happy. Hopeful. victorious, right? Now think about how we spend our lives throughout the day. Are we living here? Here on this quadrant? Or are we here? And the question becomes, how do we begin to start to shift and catch ourselves when we're here? None of us are perfect. We're in the school of life. How do we catch ourselves when we're here and at least get ourselves to neutral? And then how do we get ourselves from neutral to here? And that's where the emotional component comes in. So if I'm over here and I'm feeling angry and frustrated and pissed off, right? What's the first thing I can do to shift my autonomic nervous system? Breathe. Right, so we said we can do the 4 seconds in, 7 seconds out. 4 seconds in, 7 seconds out. Immediately, that shifts us from being up here and starts to pull us down to here. Now, what if while I'm doing that breathing, I shift from that negative thought to a positive thought? Like the grandbaby, right? Like the puppy or the cat. And it might seem like a simple thing to do, but it requires that you're in the moment and you're monitoring yourself, right? So you could take yourself from this side of the equation to this side of the equation. I'll show you why it's important in a minute. Anger, that first emotion we talked about. I'm not going to show you all the research, but suffice it to say, anger increases the risk of a heart attack 230%. Right? Everybody's so focused in the emergency room on cholesterol, but they don't even know that this person who's had the heart attack just, what do we say about angry people? What did they do? They blew a gasket. They blew a fuse. He's a hothead. Her blood is boiling. We describe it beautifully for a heart attack. And yet we're surprised when we hear that people that are the angriest have the highest death rates. Right? And look at the words that they ask people to respond to. You said a lot of them. Frustrated, infuriated, angry, annoyed, right? Fiery. You know? These are all of the things that make up the angry personality. And it is linked to major events. The other emotion that we don't do very well with is depression. So now we're moving to the next quadrant. When we're depressed, we have a 40% higher coronary artery disease rate and a 60% higher death rate in people who have documented coronary disease. Why? Well, for one, depression, when you think about it, you say, hey, I don't have to get out of bed. Forget Dr. Guarneri's egg white omelet, protein smoothie. I'm going to stay in bed. I'm not going to get up and exercise. And I'm going to have this box of donuts, right? So depression is something real, and yet we put a taboo on it in our society, like don't ask, don't tell. It's much easier to just give a medicine for blood pressure, right? So depression is a real one, as is hopelessness. And hopelessness was also in that lower left quadrant. I think you said it, right? I feel hopeless. Increased risk of vascular disease, higher risk of high blood pressure, and so on. So from a cardiology standpoint, if we ignore the mind-body implications, we're missing a major piece of the puzzle. What about, we'll talk later about the positive emotions. So we have a way to look at something called heart rate variability. That's the beat-to-beat variation in heart rate. And basically what you need to know is if your heart rate variability is low, it's predictive of a heart attack and predictive of sudden death. So it's really the ability of the autonomic nervous system to remain flexible. Here's an example of what it looks like. Here's the heart rhythm, and this is the beat to beat, and this is the timing between the beats. And a good flexible heart has a high heart rate variability. There's a lot of flexibility in the autonomic nervous system. Now, take a look at these two slides. This is a gentleman at his board meeting, and he's being questioned by the board about the business losing money, and his heart rate variability pattern is totally chaotic. So now I have to take you to the next level of this. Here his heart rate is totally chaotic. He sends a signal from his heart via the vagus nerve up to his brain, and all the brain knows is this: threat, 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 threat. The heart, I'll say it again, sends a signal to the brain, and the brain perceives this chaotic rhythm as a threat. What does the brain do? It throws the body into the fight-flight reaction. Produce adrenaline, produce cortisol, produce aldosterone. We're getting ready to run, or we're getting ready to fight. So you've heard about the fight-flight reaction, right? So when you think about it, if someone is in an auto accident and they're dying and they're bleeding to death, you want the body to produce all those hormones. Why? If I produce adrenaline, the blood vessels constrict and I bleed less. If I produce adrenaline, I raise my heart rate, and that helps my cardiac output. There's a real reason why, under stressful situation, we want to have those hormones. Now what we're doing is we're flooding the body with the hormones in response to our everyday life. So he has a chaotic heart rate variability pattern. We already said this low heart rate variability pattern places him at high risk. He sends a signal to his brain that says, flood the system with stress hormones. Now he's taken out of the room, and he's taught to breathe. And he's taught some of the Kimberly's heart math techniques. 5 seconds in, 5 seconds out. Breathe through your heart. Think about someone you love or appreciate, and his heart rate pattern goes into a totally coherent rhythm. Now the signal he sends to his brain is, this is not a threat. Goes up to the higher brain center that says, okay, this is okay. I don't have to react emotionally to the situation. I'll give you a perfect example. If someone is bit by a dog as a child, and they grow up as a fear of dogs, and the cutest little puppy comes in the room, do you think they say, oh, cute little puppy? No, they go right to the emotional center, the amygdala, and say, dog, that's a threat, and they flood their body with stress hormones. It's no different than when you smell chocolate chip cookies and you think of grandma's house, right? The amygdala is sitting there in the midbrain capturing all of your emotions, good and bad. And they're constantly monitoring what's coming in, and if it looks even remotely simple to something you've experienced, similar to something you've experienced before, the brain responds with stress hormones. Does that make sense? Okay. So we can get him from here to here just by teaching him how to breathe. So we practiced a little bit, or we talked a little bit about the heart-focused breath, dropping down to the heart, breathing 5 seconds in, 5 seconds out. 5 seconds in, 5 seconds out. And then as you're doing the exercise, you start to shift now from the left side of the curve, of the graph, to the right, by changing your thoughts, right? So you're going from, oh, I can't stand this person, they're so annoying, to now I'm breathing, I'm in the middle, and now I'm thinking about my grandbaby. So if you're thinking about your grandbaby, that other thought is going to go by the wayside, right? So it's shifting your perception, and it's very easy to do. And then once you do this for a few minutes, you can't just do it for a few seconds, you got to practice. And if you do it for a few minutes, all of a sudden you're going to find your body go into a more relaxed state, and then you're going to ask yourself, how might I handle this challenging situation? And if the answer doesn't come instantly, it will come. And you know when it will come? Well, you're going to tell me. Where do your answers come? Where do you get your insights and your answers? Where do you find them? What are you doing? You know. You have a problem, you can't figure it out, you do something, and all of a sudden the answer's there. Stop thinking about it. Okay, so you turned off then what do? When does the answer come? I know where I get it. Sleeping. You wake up and there it is the next morning. Okay, good. Who's had that experience? Right. That's why we always say, don't make any decisions. Sleep on it. Sleep on it. Where else does it come? Totally opposite. I get it in the shower. right? You get it in the shower. I always say my bathroom is magical. I get all this insight. Where else? Exercise, exactly, on the treadmill. What is going on? Have you ever wondered, why do I get these answers when I'm, you're so focused, you're in the weeds, as we say, and you don't see the gorilla coming by. You're so focused, I'm going to do this task, and I can't get the answer. And then all of a sudden I go on the treadmill. What happens is, when we're under stress, we have cognitive inhibition. It's like the brain God gave us is turned off. We're operating from the midbrain, which is our emotional brain. The minute we go on the treadmill or we get in the shower, all of a sudden we change our heart rate variability pattern and we start accessing our higher functions. And the answer lies there. And so the way to get to that is by practicing this simple technique. Because the minute you feel yourself stressed, you won't allow yourself to go into shutdown. What happens when you go into shutdown? What do you say? Things you regret. Why do smart people say stupid things? Who's ever said something they regret? 5 seconds after, are you coming from your higher brain center, analyzing the situation? I don't think so. You're coming from the emotional center. This is pushing my buttons, and now I'm going to say something. Right? So that's one of the powerful techniques that we can use. So we go to heart-focused breathing, heart-focused feeling, and then we say, what would be a more effective or efficient attitude or action for me to have? And if it doesn't come right then and there, trust me, it will come later. You will get the answer. So as we shift from those negative thoughts and negative emotions to positive emotions, and I listed the research is here from the HeartMath side, increased longevity, improvement in memory, improvement in decision making, we become more creative, we achieve more, and we have better problem-solving skills. We just become better because now we're not operating from a place of stress. So let's take a look at this. Decision-making, focus, coordination, reaction time, academic performance. The research shows everything is impacted by transitioning from a stress response to a more coherent, relaxed state. So here we go. They took 3,000 people working in healthcare organizations. If people said pre-testing, we're tired, we're anxious, we're depressed, we're angry. And I said, okay, we're going to teach you these simple techniques, and you have to practice them. You're going to breathe. You're going to do a heart-centered breath. You're going to think about something you love and appreciate. You're going to practice this throughout the day, and you're going to do something called a lock-in. When you get to that love and appreciation point, you're going to remain on that for as much as 20 minutes doing your breathing. This is what they found after just 6 weeks. Fatigue is almost reduced by 20%. Anxiety is reduced by about 10%, cut in half, 50%. Depression and anger, everything reduced. I showed you this slide before. Improvement in headaches, indigestion, body aches, and sleep. Everything improved just by learning a simple mind-body breathing and connection technique. In hospitals, they said, what happens to staff turnover? One of the biggest issues with staff turnover is I don't like going to work. I don't like my colleagues. Or there's friction between colleagues. Or people say things and they regret it and you can never repair what's happened because the damage is done. So they said, what happens if we teach these techniques? And they did this at Duke, Sierra Providence, Swedish, and so on. They looked at staff turnover over time. Reduction from 35% to 5% at Duke. Less than 5% at Sierra Providence. So when I look at some of this data, I think, why aren't we, all corporations, using these techniques? You know, you become more gentle with yourself, and you become more gentle with your colleagues. When you come from a place of being grounded, and you're not flying off the handle, and you're listening to people, and you're keeping yourself in a calm, relaxed state. And you have to practice it. It doesn't come without practice. In my previous talk, I mentioned this concept of picking a mantra. a sacred word, a chant, or a sound which is repeated over and over again with the goal being to cultivate peace. If this resonates with you, go ahead and find a word, because what will happen is it will keep your mind from jumping from branch to branch and thought to thought, as we talked about in the previous session. And we mentioned it improves heart rate variability. So if I'm doing my mantra and that improves my heart rate variability, the signals I'm sending to my brain are more coherent, and I'm not flooding myself with stress hormones. So it's all connected in a very simple yet scientific way. And it's just something as simple as a mantra. Does anyone here use a mantra? Okay, we have 2 or 3 people that use a mantra. Let's see, we have a few minutes. Let me just see if I can get a mantra to play for us. Let's give this a shot. Sometimes we get lucky. There we go. So this is one of my favorite mantras, but you may find one that you like. And I play these over and over at my house too, because I find them very soothing and very relaxing. So just let yourself go into the mantra for a few minutes. And if you want to chant it, no one really cares what you sound like. Just see, where do your thoughts go? And what do you let behind just by letting the mantra come in? And it will bring you to that place of peace. And maybe we should have Evansville chant some of our neighboring communities, like Ferguson, which is not far from us. So I start my day with mantras playing in the house. I have mantras playing all the time. I don't have TV as my background noise. I have mantras as my background noise. And that's something I invite you to think about. Is how do I start to cultivate an environment of peace? And it may not be hallelujah that works for you. It may be another mantra, or it may be something that connects you to nature. Go. Yeah, it's almost like a shock to the system to take it off. This is some of the research. This was done with Vietnam vets who had post-traumatic stress disorder. If there's anything that takes you back to the scene of the crime, is hearing a bang outside your house, not being able to take your mind off of the events of the past, they said, what happens if we have these vets learn a mantra? Perceived anxiety, perceived stress, anxiety, anger, religious well-being, spiritual well-being. Take a look at the p-values here. For those of you who do research, a p-value less than 0.05 is significant. 0.001, 0.001 on stress, on anxiety. So this is not a drug. This is powerful medicine. And it's as simple, just like having the breath, as taking a word, putting it into your life, and just playing it over and over again until you get to the point where it brings on inner peace. And one of the vets said in this research study, he could not turn his brain off. He said, I just couldn't do it. And he said, I decided one night I was just going to practice my mantra until I either passed out or I got it. or I was able to turn off the other stuff. And he said he sat up until like 4 o'clock in the morning, and he was able to finally start to hear the mantra instead of the other things that he was hearing. So it requires practice. It does. In our culture, we're not taught to do this. You know, I was taken to church every Sunday, but I was never really taught how to go in and find inner peace and meditate and pray in a different kind of way, and what the potential benefits of it was. I mentioned the meditation study from the American Heart Association, 48% risk reduction in cardiovascular events. And all meditation is sustained attention. That's all it is. And does this group here do mindfulness in this area? Is there an active mindfulness program at all? Yes? Some people are saying yes. There are lots of forms of meditation. From the Christian tradition, we have contemplative prayer. Right? From the Buddhist tradition, we have mindfulness. From the Hindu, or really from the Indian tradition, not even Hindu, we have transcendental meditation. So there's lots of forms of meditation, and the question is, what resonates with you? I know for me, I went through everything, and I could not sit down and be calm. And it wasn't until I learned transcendental meditation that I was able to take my seat, shut up, and meditate for 20 minutes. All right? That's what worked for me. Contemplative prayer may work for someone else. Mindfulness may work for someone else. And what the research shows, aside from this, is this, which is really important. There's a woman named who won the Nobel Prize. Her name is Dr. Elizabeth Blackburn. And she studies something called telomerase. You guys familiar with this? So this is the enzyme of longevity. And she found that how you live your life impacts your longevity enzyme. So she looked, for example, at moms who were caregivers of sick children. And she compared them to moms that had healthy children. And she found that moms that were caring for sick children were 10 years older based on their enzyme activity, on their telomerase, than moms who did not have sick children, even though they were the same biologic age. So she got the Nobel Prize for this, for her discovery of telomerase as a potential thing to measure for the actual age of someone's body. So when I mentioned in the first lecture, you could look at a yoga instructor who's done yoga for a long time and they look 20 years younger than they are. I'll guarantee you their telomerase activity is different than some of us who are completely stressed out. So she went on to study, well, what happens to this enzyme if we teach people to meditate? And this is what she found. The activity was significantly greater in retreat participants who were learning to meditate than in the control groups, even by the end of a retreat. So this didn't take 25 years to accomplish. And for years, we have known things like meditation, even acupuncture, lots of things that didn't have a scientific basis that we can understand mechanistically, we're now starting to be able to study with research models. And studying telomerase and the impact of this with some of the interventions that we do has really been a game changer, because now we have a science that starts to explain the so-called mysticism that we didn't understand for years and years. So when someone says, here's this, like my patients, I give them their medicines, but they also get a prescription for meditation, if that's what I think they need. I just saw a gentleman in New Jersey, and he was laughing at me. He wanted to take all the supplements in the shop, and he was sitting there the whole time, and his leg was going like this, and when he didn't like what I was saying, he would put his arms like this, and I was just observing all of this. And I said to him at the end, I said, what you really need is meditation. And I said, and I'm going to set it up so someone comes to your house and teaches it to you. And so finally he said, okay, right? Because he had heart arrhythmia, he had anger, he described himself as OCD, he describes himself as attention deficit. Meanwhile, he's an incredibly successful businessman. right? And all of these things that he was describing that were interfering with his life were being driven by stress hormones. So now we can say, not only does it reduce cardiovascular events, but meditation improves telomerase activity. So this is really profound medicine. Now, Florence Nightingale said this: the needs of the spirit are as crucial to health as the individual organs which make up the body. Why do I think it's important? Because I practice holistic medicine. And when you look at the chair you're sitting on, it has 4 legs: body, mind, emotions, and spirit. So for your body, we talked a lot about what is the right food. And by the way, I'm going to have to do that lecture again because I notice people eating those chocolate chips or whatever they are out there, even after my lecture. So obviously, I wasn't impactful enough, and I will figure that one out. So I know what I have to eat. I'm going to get a good night's sleep. I'm going to go get that pedometer, that Fitbit, something, and I'm going to monitor my steps and everything that I do, right? I'm going to do that for my physical body. And then for my emotional body, I'm going to pay attention to where my mind is. Am I angry? Am I jealous? Am I irritated? Am I annoyed? Am I frustrated? All of those things. And I'm going to start to put into place some of these simple breathing techniques that are going to impact that. Where am I at emotionally and mentally? Right? Do I feel hopeless? Where's my support system? Right? Where do I go for my support? Where's my tribe? And the key, the 4th piece to the stool, is your spirituality. What gives you a reason to get out of bed in the morning? What is your purpose in life? Does everybody know their purpose in life? Or think you know it? Yeah, some of us. Does everybody have a mission statement or a vision statement for their life? You do. You know, people say to me, what's your vision? I say, healing people and changing lives through science and compassion. Right? But it took me a long time to get to that. But what is my purpose in life? What is your purpose in life? So I get that personally from my spiritual practices. And when I started to teach in the 90s, heart patients, I focused everything on diet. And I made them completely crazy. I made all my patients 10% fat vegetarian. They were just, they did it. And we were participating in research. And their chest pain went away. But I started to realize, oh my God, they're so anxious that they're going to eat a speck of fat, that anxiety about eating that speck of fat is worse than eating the speck of fat, right? So I started to think about what was really driving the train, which was stress for a lot of people, and then this lack of connection. And I put that in the spirituality category, but you might say, put it in another category. So what is spirituality? Lots of definitions. Chopra says, the transformation from separation to unity, from conflict to peace, is the goal of all spiritual traditions, right? So I think that's a nice way to think about it. And as a physician, I started here. This is Rachel Naomi Raymond. She said she used to fix problems. I used to fix problems. I used to put stents into clogged arteries. And I will tell you, when I was on call in the hospital and I would get a call and a patient was going to be admitted, I'd be like, ugh. It was almost like, do we have any docs in the room? Doctors in the room? No? You know, I'll tell you a little secret. When a patient would get admitted to the hospital in the middle of the night, we would call it, we were getting a hit. H-I-T, right? Getting a hit. That's a terrible thing, right? Then I started thinking, okay, I'm helping people. Well, if I'm helping somebody, I'm better than they are, right? I'm going to help you. I'm better than you. I'm going to help you. And my whole life transformed when I began to see my practice of medicine as service. What was I sent here to do? I was sent here to serve. And this is my service. Transformed the way I thought about it. One of the great spiritual practices that has to come into how we look at our lives is forgiveness. This is the hardest thing for every one of us to do. Forgive others, forgive ourselves. First, start with ourselves. And there are many patients that come into my office, and I have to have them start with just simply saying, I forgive you, you forgive me, we forgive each other. And I tell them, see people, just see faces over and over in your mind. And there's a lot of confusion about forgiveness, because forgiveness is for the forgiver. It's for you. It's not for the offender. People say, oh, but they did this to me. It's not for them. It's for you. It frees you to call your spirit back. It pulls your energy back to you. You're no longer a victim of this story. You become a hero of the story. So it's about taking back your power. It's about your healing. It's not about the people that hurt you. And one of the best studies and one of the best books, I think, in this area is Dr. Luskin's book called Forgive for Good. Great book. It flies off the shelf in my office. And really, what he said, he looked at in the Forgiveness Project, he said, what happens when people start to forgive? Forgiveness allows a feeling of peace that emerges as taking hurt less personally, taking responsibility for how you feel, becoming a hero instead of a victim. And that's powerful medicine. I guarantee you there's at least half of the people in this room that haven't forgiven themselves for something. Right? I should have did this. I didn't do that. Right? Or there are people that we're angry at. It always saddens me. And when I was at Sloan Kettering, the cancer hospital, and people would say to me, I haven't spoken to my brother in 20 years. What did you fight over? I don't even remember. It was so stupid. Why didn't you call him? I didn't want to be the first one to pick up the phone. Right? And what is he waiting for? His brother to come visit him so he can transition to the next event. Right? So become the hero. What did he find in the research? Decreased blood pressure, less muscle tension, decreased heart rate, a positive correlation between forgiving and fewer illnesses and few chronic conditions. Right? So think about it. If you're angry all the time, if you can't let it go, if it's playing over and over in your head as a song, a negative song, what is that doing to your immune system? What is it doing to your blood pressure? What is it doing to your cortisol? So when we think about mind-body medicine, to me, I can't separate it from some of these principles. It's as important to meditate as it is to forgive. It's as important to breathe as it is to have compassion. He found forgivers, less anger, less stress, healthier, more optimism. So forgive for good. And we all know who we are, and we all know what we have to forgive. And we have to work at it. This is another spiritual principle that profoundly affects our health, and you may or may not have thought about it. But it's service. Buddha said, the man who is shaped by selfish thoughts causes misery whenever he speaks or acts. The man whose mind is shaped by selfless thoughts gives joy when he speaks or acts. So there's something called the helper's high. Who's a volunteer in this room? Do we have any volunteers? How do you feel when you volunteer? Fantastic. Anyone else? You volunteer? How do you feel? Good, right? Great. Does anyone directly work with people where they serve food or do anything like that? How do you feel when you do that? Amazing. Help is high. The research shows less depression, feeling more stronger and energetic. I'd say that's amazing, right? Fewer aches and pains. Forget about my toe arthritis. I got to get these meals on the table. People are hungry, right? I'll tell you something else, I think, and you may or may not agree with me. But I think everyone has a drop of the divine in them. And I think when you bring joy to someone, when you serve that plate of food, it's soul recognition. And what that person is experiencing, you're experiencing because you're connected. I firmly believe that. And to me, that's the difference between joy and happiness. Happiness is, I got a new pair of shoes. I like them. They're good. I'm happy for 24 hours. What's the next event? Joy is what you just described. You feel terrific, and you'll never forget it. And it's soul recognition. I'm convinced of it, that's what we're all connected at a level. And when you're happy, and I've done something to bring you joy, I feel it because I'm connected to you. And I think that's the magic of service. And the research pans it out. This was MS patients, people with multiple sclerosis. They said to them, would you be willing to sit on the phone and give guidance to other people who call in that need help? So those people that volunteered got on the phone, talked to other people with MS, talked to them about support groups and their diagnosis, not giving medical information, just connecting. Those people on the phones, improvement in everything, depression, self-confidence, self-esteem, and physical functioning. So what do we say? It is in giving that we receive, right? So this is a key to stress transformation. So I always think of forgiveness, I think of service, and then I think of compassion. How do we become more compassionate human beings? His Holiness the Dalai Lama said, from my own limited experience, I have found that the greatest degree of tranquility comes from love and compassion. The more we care for the happiness of others, the greater our sense of well-being becomes. Right? And the Schwartz Institute, Schwartz created a Compassion Institute. His family followed up. He had cancer. He said, the love and devotion of my family and friends, the deep caring of my caregivers were a tonic for my soul and helped take away the sting from my scalding tears. You heard that beautiful story this morning by Ron, right? What he was experiencing from those caregivers that came to his mom's house was compassion and love. So the concept of gratefulness, is my glass half empty? Is my glass half full? Every day, if you are one of the negative types, if you who watches Saturday Night Live here, anyone remember Debbie Downer? All right? If you're the Debbie Downer in the group, I want you to start writing down 10 things every day you are grateful for. The sun in the sky, the fact that you have water to drink, your healthy grandkids, and they have to be 10 different things every day. Can't write the same thing every day. So practice gratefulness. So how do we reconnect? Reconnection is key. I teach this to physicians because many physicians have lost their way. And they lost their way because the reason they went into medicine has changed so profoundly. We say, how do we reconnect with our spirit, with what's important in life? How do we find meaning and purpose? Practice compassion and forgiveness. Transition from I'm going to fix this problem to I'm going to serve my community and my tribe. Who is my community and who is my tribe? You know, the I in illness is isolation, right? And the W-E in wellness is we. Isolation makes people sick, right? Loneliness is a disease. So how do we connect and find our inner peace? So at the end of the day, love heals. And this is the electromagnetic field of the heart. Have you ever wondered when you have an EKG, how do we measure the heart from the hands and the legs? Because the heart has an electromagnetic field that expands out as much as 15 feet from the body. So who do you bring into the room when you come in? If you come in breathing and grounded, filled with compassion and love, people are going to walk in the room and say, hey, I want to be here. Have you ever walked in a room where there's just been a fight? What does that feel like? Right? It's awful. Right? You say, oh, bad juju, I'm out of here. You could feel it because of this electromagnetic field. Don't let anyone tell you it doesn't exist. Science has to catch up with what we all feel. Right? It's just starting to catch up with some of these things. So Marianne Williamson said this, we are not held back by the love we didn't receive in the past, but by the love we're not extending in the present. So at the end of the day, when you think about how am I going to put this whole mind-body piece together, it's recognizing that things like depression and loneliness and stress have a huge physical impact on our body, but that we have control of that. And we can transform the way we see the world. We can let go of the things we can't control. We can bring simple practices in our life, like the breathing techniques. And we can go out and we can do our forgiveness work, do our service work, practice compassion and empathy, and that will help our well-being. So thank you for your attention. And I'll put up those websites today. There we go. So again, info on the website. Do we have a minute for questions, or are we right on it?
Can we tell it those that want to go?
Sure, of course. Anyone who wants to go, you're free to go. Anyone who wants to ask a question, I can stay for, because we have a break. Yes, ma'am. It takes you down. But you're letting it take you down. You let it take you down. So you got to change your perception to it, and you have to pray for her, and you have to hope that she sees things differently, or you have to disconnect. Yeah, she's a worry wart. Yeah. We all have people like that in our life. Send her light and love, light and love, light and love.
We're competing with lunch, so
Yeah, that's okay.
This was
we
excellent.
can compete with lunch. That's fine.
If anyone has any other
and I can
questions or
stick around.
comments, yeah,
Yeah.
just come on up. But thank you for your great attention. Thank you
Thank you.
for